All right, we got this huge healthcare debate going on, and one of the things is both you and I, Kevin Williams here, Brian Barger here, we know that there's a lot of mistruths going around about the healthcare bill, about what the Democratic administration has proposed. Kevin, you've got some great views on things. You're kind of like an everyday man. You have a good job. You got a family. What are your thoughts on what's going on with healthcare?
Well, strangely enough, it's not as much. Okay, healthcare is an important issue in and of itself. But to me, the bigger issue is the people surrounding the issue. That's where I'm having the difficulty, because I don't feel as though you can really have a debate, or even a discussion, or even intelligent discourse, if people are not on the same page when they begin. And what I mean when I say that is, this morning, today is the 12th?
Today is August 12th.
August 12th of 2009. This morning on the news, there was a young lady at one of the town halls, and she was very upset.
Now, these are town halls that the senators are having while Congress is out of session.
Correct.
Okay.
And she was upset. She was talking about how she'd never been involved in politics, but she is so upset at this point with all that's going on that she now needs to say something. She has to be heard. And you know, I feel for her to a certain degree, but my problem is with her next statement was, I don't feel as though we should have our government involved in health care, because since when has our government ever done anything right? And I'm quoting, actually, when has our government ever done anything right, was her statement.
And the reality is that the proposal that's out there from the Obama administration really doesn't have the government involved. It's a free market system that has a safety net for people. So she's saying that means that government will take over our health care. Is that right?
Absolutely. So again, we're beginning from a position in which we can't have an intelligent dialogue, because one person's already assuming that what we're talking about is one thing, while what we're actually talking about
is something
the actual proposal is something completely different. But also, it's the attitude, and I'm wondering oftentimes where. Well, I know where it comes from, to be honest, and it's a sad state of affairs that I do understand where it comes from. But I'm wondering sometimes the motivation of the people who feed information to this conservative movement right now. Like she said, she stated, when has our government ever done anything right? And I'm thinking... You got
an interesting perspective on that.
Absolutely. I was immediately thinking, do you hate America? What would make you say, when has our government ever done anything right? Why would you assume that all these people around the world have wanted to come to the United States? They wanted to come because we had the worst government in the world? It literally doesn't make any sense. Our military, I have asked many people on both the right and the left, who's got the best military on the planet?
Yeah.
They've all agreed. The United States.
The United States, exactly.
Well, that's the largest undertaking our government's ever done. In fact, to this day, they employ more people. And now, it doesn't mean it's perfect. By no means. It doesn't mean there's a lot of waste going on. But the point is that it's the best run military on the planet, and our government runs it. Medicare is one of the best run functions of our government. The VA hospital has recently been given lots of encouragement with the notion that they outperform the private sector hospitals.
And even with the poor revenue situation and all of that.
Even with a certain group of people continuously trying to underfund it, it still outperforms the private sector.
So what you're saying is that the government runs our U.S. forces. They've done a great job in terms of creating the best military in the world. And so when people say that the
government is incapable of running anything,
all you got to say is, do you support the U.S. troops or not?
It's just right. It is just unreal to me, though. I'm just amused at how am I going to have a conversation with you about something if you just don't believe that our government is any good. And yet, at the same time, you're the first to turn to me and tell me I'm un-American, or you know, don't you want to? You're the most American, or you're the most patriotic. When every chance you get, you seem to downgrade our country. You downgrade our government. You say it's no good. When asked about our freedoms. You tell us, oh, they're going to be upset with America because of America's freedoms. Well, all I hear is you going against America's freedoms. Mm-hmm. I mean, you don't want there to be rights for women. You don't want there to be rights for homosexuals. There's a lot of things that we fight against in our country, and I think the healthcare debate is just a symptom of a bigger problem.
Let me ask you this. It seems to me that two of the major issues in the health care proposal from the Obama administration, one is to help control health care costs because it's just eating our national budget alive. But the second, and maybe even the most important, is that we've got nearly 50 million people in this country who don't have insurance. One of the biggest reasons for bankruptcy is people who go bankrupt because of they can't pay their health care bills. And so what these people that are attending these Senate town hall meetings that are screaming about not wanting health care reform, are you telling me they don't care about the other 50 million people that don't have insurance?
I'm saying I don't know what they care about because they're very unclear. They are using a great deal of, they're being led by a great deal of misinformation, and it's all political. And they don't realize
And I think that's the bottom line.
And they don't realize
yeah.
What I'm talking about, and I don't mean forget the 50 million uninsured, mm-hmm. but let's just step the 50 million uninsured aside, mm-hmm. and let's look at me, you, and the rest of the people. We know every day of the week there are people in this country who are denied services.
Absolutely.
So let's not say that in other countries you're denied services and blah, 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 blah. Let's just acknowledge today that there are people every day being denied services. People are dying in the United States because they were denied service. There are people who are not going to get the services that they may need because they can't afford it. Mm-hmm. And
or they can't get in to see their doctor. The emergency room's crowded. This happens every day. I can give you plenty of personal stories about it.
So can I. So can I. And that's what I'm... But yet, how can you have a real discussion with someone who assumes and believes that every time you get sick, the magic fairy comes and you're already taken care of and everything works?
The doctor comes to your house, the hospital door opens, it's absolutely beautiful. That is not reality. The reality is that we've got a private pay healthcare system in this country. Absolutely no doubt about it. It's a private pay, private run healthcare company, healthcare program in this country that is falling apart at the seams.
Absolutely.
And until you've experienced it, a person doesn't even know what they're talking about. My mother sat in an emergency room for 48 hours, literally shitting on herself because they didn't have a room for her. Now, are you going to tell me that's not rationing care? That's absolute rationing.
It's clearly rationing care. These are all symptoms of a bigger problem in our. And I know it's hard to get to that in such a short period of time, and then I'm jumping from thing to thing, and I really don't want to do that. But
it's a big issue.
It is. But our big problem is that we don't really accept who we are and try to work from there to fix it. We accept this ideal of what we have and who we are. Mm-hmm. Okay? If we were able to acknowledge some of the flaws that we have, then we certainly could correct them. But if you never acknowledge that the flaw exists, then we're going to have a very difficult time figuring out a way to move forward and make things better. Mm-hmm. So in the end, the big problem is that these debates, you're seeing people coming in.
They're really
debates. They're not debates. They're supposed to be discussions, town halls.
They're screaming matches by people who are politically motivated.
They've been sent there.
Yeah,
they've been sent there with an agenda to disrupt. And my feeling is a very simple